Our next award tonight is for Management Excellence. It recognizes federal employees whose accomplishments help our government serve citizens more efficiently and effectively. Their work often involves important processes and procedures the public doesn't hear about typically, including those that ensure developments in science, health, and other areas to deliver the benefits that are promised and are safe for the people who use them. Here to present the award is an inventor and entrepreneur who has navigated those processes a few times. He holds more than 440 U.S. and foreign patents, including the Segway, the first wearable infusion pump, and other innovative medical devices. Please welcome to the stage Dean Kamen.
I know I should be reading some stuff here. I don't know how to do that. I'm here because I have a very personal interest in the extraordinary accomplishment represented by what Dr. Lias and Dr. Beck have done. I got to meet them just during the reception period, and I showed them something. Since the whole recognition for what they did is they accelerated dramatically by years the amount of time everybody predicted the FDA would take to approve something as monumental as an improvement in treating people with diabetes as doing closed loop in artificial pancreas. It's like we've had cars for 100 years, but now let's make them self-driving. That's not like adding cup holders. That's a big, big change in cars. And Banting and Best won the Nobel Prize for discovering what you could do with diabetes in 1921. And for 40 or 50 years, people took a shot or two and they learned it was bad. My older brother was an MD, PhD student, brilliant guy, pediatric oncologist, and I started building pumps for him to deliver drugs to babies when he was still a med student at Yale. That's so long ago, there was no FDA control. I got to tell Dr. Lias and Dr. Beck that I showed them a pump that I built in my parents' basement, gave it to my brother, he used it, he lent it to a doc at Yale, who later deployed it on people with diabetes, and it became a standard of care after a few years. And I was quickly told, Dean, that's great, but you got to close the loop. Just giving insulin doesn't help unless when that kid, and it's most often kids, eat that ice cream cake, they need more. When they go to sleep, they need less. And we all take for granted, people take insulin. Listen, everybody, insulin is life support. You give too much of it or too little of it, you're gonna have catastrophic events. Anyway, after I'd been building these for a few years, people said, close the loop. Yeah, to close the loop, it's like saying let the car be self-driving. You need sensors that sense glucose, and they have to be really accurate, and they have to work all the time. And they have to be reliable and affordable. And when you get that information, the glucose is going up or down, how much do you give? And what if you give too much? And what if they start to, quote, crash? Well, you need software to mimic the complex physiology of a person. You need to communicate between that sensor and that pump. You probably want that information going to the cloud, which didn't exist when I was making these things. So I told everybody, look, I made a pump, it's good enough to be that first step. We made a car, but it'll be a long time. I told them 10 years before people make sensors that are reliable and safe. And it'll be a long time before computing the right amount can happen in the appropriate way. And I basically said, and I'm an optimist, I said it'll take them 10 years. I was wrong. It took them about 25 years. But a few years ago, it looked like the industries, the various companies that make glucose sensors, insulin pumps, insulin, software, understanding, it looked like they all had it. It looked like it might work. But now think about this. Imagine the FDA being charged with the following. We got to go figure out how to connect all these things. We need hardware companies, software companies, systems companies, sensor companies. How do you put all these things together? How do you make sure it's so safe that the benefit exceeds the risk, especially when most people think, oh, a shot is okay because the effects are long-term. I predicted a few years ago it would be so complex, and we've created a society that's so risk-averse. it probably would take even longer than would be appropriate. And then imagine that companies push hard. They have an upside. We all know that the FDA has the thankless task. If anything ever goes wrong, there's never a shortage of people to cast blame. When everything goes right, we quietly assume we're entitled to the solution. And by the way, it should come fast, it should be free, it should have no risk. We have a society that takes a lot for granted. Anyway, a few years ago when I saw this going, I again thought, it's going to be a long time. And when I saw that the FDA reached out to the various technical leaders in this country, in this industry, and as you'll hear, they put a couple of people at the FDA empowered that really understand how meaningful it would be to give kids closed-loop control, to let moms and dads go to bed comfortable that when they get up in the morning, their kids are going to get up and not be in insulin shock or ketoacidosis. There are millions of kids and tens of millions of people in America that can benefit from an artificial pancreas. A lot of companies will benefit, but as I said, you have a situation which is, tails, we all win, heads, a government agency loses. They take all the blame, they have to assess the risk, and the benefits go to the public, maybe to the companies. But when I was asked to help recognize what an extraordinary achievement it is that the FDA managed to approve a closed-loop system 3 years ahead of schedule by integrating all these technologies, that would be like you finding out tomorrow you could go out and get into a self-driving car that's better and safer than anything you've ever seen. And it's incredible. So I'm told that we're going to see a little of that as told by Dr. Elias right now.
Innovation means that there is something new about a product. It's meeting an unmet need. And when there's an unmet need, it's usually the case that there's some challenge to filling that void for a patient. Innovative new devices are things that can really change patients' lives. And that's what we really want to focus on getting more of. Millions of people in the United States have diabetes, and it's one of the things that consumes a large chunk of the healthcare dollars in the United States. And so if we can solve outcomes or long-term health outcomes for people with diabetes, that will not only help those individual people, but it will help society in terms of reducing the cost of healthcare. Our team works on what's called automated insulin delivery systems, sometimes called artificial pancreas devices. These devices sense sugar in the blood, make decisions using a computer algorithm, and then tell an insulin pump how much insulin to give a person with diabetes. At the end of the day, we shave 3 years off the time that the device was planned to be on the market. And I am so lucky to work in a culture within the federal government that promotes a reasonable approach, that promotes reasonable decision-making, and really has the patient's best interest at heart. The stories that come in from patients about products that, we had a hand in, there's nothing more motivating than hearing from a patient that a product that you worked on helped them.
So now, as I said, after showing you a 40-year-old pump, I'll show you two young professionals that are going to change the world for a whole lot of people. Congratulations.
Thank you. This is an incredible honor, and we are so excited to be a part of such an accomplished group of nominees. Our work is truly driven by people living with diabetes, so we would like to thank the diabetes community, including researchers, companies, advocacy groups, and patients, for working together with us to help get this innovative device into the hands of the people who need it the most as quickly as possible. We would like to thank our group at the FDA, whose foresight allowed this to be addressed in such an innovative manner. Their dedication to protecting and promoting the public health is truly unparalleled. We would not have been able to accomplish this without the support of our families, for which we are appreciative. And finally, we would like to thank the partnership and program sponsors for the opportunity to shine the spotlight on people living with diabetes. We are making small steps towards improving the management of this disease, but a lot of work remains to be done to find a cure, so we thank you for that.